Doctor, what do you think about the new dental chair technology and what are the key features of your dental chair?
The key features are well-being, integrated and automated. Well-being is the well-being of the patient and the dentist. So that is basically to maintain the health of the dentist related to the health issues which are caused at the end of the day for the dentist after the long working hours, the standing and the sitting positions. We advise the dentist to use the 7 o'clock or 17 o'clock position, which is very comfortable in our units. And integrated is basically the water units and the suction units, which are segregated and easy accessibility for the dentist also. Automated, our units are totally automatic. So I would like to take you through the demo of the dental unit. This K2 dental unit is a cantilever model, and based on it is totally mounted on a pillar. It is a baseless model, and if you see the backrest, it has a wide curved backrest which is made up of aluminium, and the headrest is a double articulated pneumatic headrest which can be adjusted according to the patient's convenience. The K2 seat is a foldable chair where the seat is foldable at the leg rest, and it is basically used for geriatric and pediatric patients. So that is, it occupies less space and it is very comfortable. If you see the upholstery, it is smooth, it comes in different colors, and it is easily cleanable and maintained for many years. If you see, even after 5 years, the upholstery remains the same without any issues. Next, the working element, which is a very important element for the dentist to operate on. So the working element is one of the features of Airel, which is the touchscreen model. So we have the different features, which is up, down and back front movements, and different chair positioning which can be saved by the dentist. If it has a USB and a card, so each dentist who uses this unit can store his features based on his requirement. So the next time when they reuse this unit, their features will be reflecting on the unit. It has a protected password, so each card actually is just like a small card which is used by the dentist. So once it is inserted, all the features are reflected on the screen. So this is one of the features of the Airel dental chairs. So the next is the elements, the turbines, which are electromagnetic, and they are very flexible, if you see, and they are very light and easy to use by the dentist. Generally, the dentist land up with the shoulder pain and the arm pain after using the elements. But this is so light that the dentist will never feel the pain on their arms and the shoulders. So this is why Airel has a very important plays a very important role in design of the dental unit for the dentist. We also have another feature called the disinfection system, where after every use of the turbines and the handpieces, generally during a surgical procedure, generally we send the patient back and ask them to come back probably the next day or evening because it needs to be autoclaved. But one of the features of our Calbanium, which is integrated in this unit, is the Calbanium, where you place the handpiece inside after doing a surgical procedure, and you see within 2 seconds there are fumes which come out which cleanse the handpiece, and it is ready for use by the time the chair is cleaned for the next patient. So that is one of the features of this unit. So the dentists don't need to waste their time for calling the next surgical procedure. It can be done back to back without any disturbances. Also, the tubings are all food grade tubings and the medical grade tubings which are used in our dental units. So it's easy to clean. And as I have already explained, the IGN system, which consists of the Calbanium, which is a special feature of this unit, which cleanses the entire tubing of the dental unit and provides a thin biofilm which prevents the bacteria and algae from forming inside the tubing, and that is the main source of contamination for the dentist and for the patient. So that is basically, that is the main thing which generally in today's world no one wants to focus on this. Everyone wants a good dental economical and hygienic and best dental chair, but I think Airel is the only chair manufacturer who caters to the hygiene of the patient and the dentist. Next, I would be explaining about the suction, where we have the low wax suction and the high wax suction. For this is basically used in the mouth of the patient to drain out all the blood and the saliva and everything. And one of the features of Airel units is suppression of the spittoon unit. So I'm sure you will be surprised as to how a dentist could work without a spittoon unit, but it is very easy. It is the mindset which the doctor can create in his environment with the patient and train the patient psychologically as to what is the disadvantage of having a suction, because cleaning is one of the hygiene is related issues, blood contamination and aesthetics, which looks very bad, where you can see all the blood and the saliva flowing everywhere, which is not a very good sight for the patient. Generally patients get scared seeing the blood also. So when you are using the dental suction, so that the patient is more comfortable for the treatment, and you can save time in the treatment. Basically each time the patient spits in the spittoon, you lose, if you don't, basically the dentists don't realize they lose almost around 5 to 10 minutes in the treatment procedure. In that same time, you can accommodate another patient of yours and make more money. That's the basic concept of suppressing the spittoon. And we have supplied dental units in Bangalore, in India, without the spittoon, and that practice has been going on for almost 7 years by many of the dentists in India. So we can say it is a success. So it is the mindset where the doctors need to incorporate into their dental chairs. Next, I would like you to show the arms, which are very sleek and very slender, if you see, and the paint is finished, polished, shiny finish, which we focus on the medical grade painting system here. And we also, if you can notice, in our units, we don't have the armrest. So the armrest is one area which is a main source for contamination, both for the dentist and for the patient. So generally patients, after spitting, they try to touch the armrest to hold it, to feel more comfortable, but that is the wrong concept, because this is a main source for contamination for both the dentist and for the patient. You see the blood stains and the saliva stains, which is all generally there after the patient leaves from the dental unit after the treatment. So because of the absence of the arm here, so it's easy for the patient to enter inside and move out, and cleaning is very easy on this unit. Also,